Let's examine this elderly lady with ulceroproliferative growth in the oral cavity. We can see a swelling over the cheek. Mouth opening is adequate, though slightly restricted. Halitosis is present. We can see a ulceroproliferative growth of about 6 into 4 centimeters in the left gingivobuccal sulcus, extending from the canines up to the retromolar trigone, and laterally from left gingivobuccal sulcus just onto the floor of the mouth. Edges are everted. Floor is covered with tumor tissue and slough. On palpation, look for the presence of induration and its extent beyond the visible margins of ulcers. Also look if the ulcer bleeds on touch. Here the mandible is infiltrated and eroded. In case of smaller growths or ulcers, we can do a bimanual palpation to make out irregularity or thickening of the mandible. For this, put the index finger of one hand in the mouth along the inner aspect of the mandible and other finger on the outer aspect, and run both of them along the mandible. Other clue for mandibular infiltration is presence of loose tooth. Make it a habit to examine the rest of the oral cavity, upper and lower lips by averting them, upper and lower gingivobuccal sulci, the tongue, and the floor of the mouth. Soft and hard palates. This has to be followed by the examination of the lymphadenopathy, which could be secondaries or infective etiology.